Traveler's diarrhea is probably the most common illness affecting travelers. Essentially, it's the sudden onset of abdominal cramping and pain associated with diarrhea that may last a day or even a few days. And in most people, traveler's diarrhea is self-limited, meaning it's gone. Once it's over, it's over. But in a small percentage of people, symptoms never go away. Some people never get better. They continue to have diarrhea, persistent diarrhea, or they have abdominal pain, cramping, bloating, gas, or a change in bowel habits. Now, this is a common syndrome that's now known as post-infectious irritable bowel syndrome, post-infectious IBS. And interestingly, having been in the field of travel medicine now for the past 25 plus years, I was struck by the fact that I was seeing a lot of people coming back from foreign travel who were coming to my gastroenterology practice in New York with complaints that their bowel movements had never been the same since they got sick with that parasite or that bug that they happened to pick up in Mexico or Thailand or wherever it was they traveled. And we were seeing enough of these patients that we termed this at the time post-infectious enteropathy, enteropathy meaning inflammation or pathology of the intestine. We did all kinds of tests, microbial tests, we did parasite tests, and really were unable to find any particular cause of illness in these people. Now, about a decade later, investigators in the United Kingdom were noticing that in outbreaks of gastroenteritis, where there was food poisoning in towns like Sheffield and Nottingham, affecting hundreds of people, even thousands of people, may have been traced back to a bakery where there was contaminated bread. A certain percentage of people, maybe 5 or 10%, never got better. And they termed this post-infectious IBS, and we realized what we were calling post-infectious enteropathy was really the same thing. So we realized that this was a distinct syndrome, and since that time, we've discovered there are certain specific elements that can be discovered in terms of biopsies, responses to certain treatments that set aside or set apart this illness from garden variety IBS or irritable bowel syndrome. There's a specific diagnosis of post-infectious irritable bowel syndrome, and by knowing that, it allows us to tailor therapy and treatment to the individual. So this is something that's become widely recognized and widely known in medicine, in gastroenterology, but interestingly 25 years ago was practically unheard of.